everyone, in this video we will discuss labor induction. Inducing labor is the process of stimulating uterine contractions during pregnancy before labor begins on its own in order to achieve a vaginal birth. There are a number of reasons why your healthcare provider may recommend a labor induction, but in general, the main reason would be due to concerns for mom or baby's health. Labor induction may be recommended for the following reasons. If your baby is approaching 2 weeks past your due date and your labor has not begun on its own. If your bag of waters is broken but your labor hasn't started. If you have an infection in your uterus. If your baby isn't growing appropriately. If there isn't enough amniotic fluid surrounding your baby. If you have diabetes that develops during pregnancy, also known as gestational diabetes. If you have high blood pressure during pregnancy. If there's a concern for the health of your placenta. Or if you have certain medical conditions. What I've mentioned so far are medical reasons for labor induction. You may have also heard of an elective induction. What this means is that there's no apparent medical reason that a pregnant person needs help starting their labor. There may be certain reasons that an elective induction is appropriate, and this should be discussed with your provider. So what happens during a labor induction? There are different methods that can be used to get your labor to start and progress. Certain medications can be placed inside of the vagina that will work to prepare your cervix for labor by helping it thin out and soften. Another way your provider can induce labor is to insert a small tube with an inflatable balloon that rests on your cervix. This also helps soften your cervix and can help move labor along. If your bag of waters has not broken, your provider can make a small opening in this bag of fluid with a plastic hook. This is known as an amniotomy, and you may have also heard it called breaking your water. This is only done if your cervix is partially dilated and your baby is low in your pelvis. Lastly, labor induction can happen by giving a medication through an IV called Pitocin. Pitocin mimics a hormone your body produces naturally called oxytocin, and it tells your uterus to contract. Your provider may use one or a combination of these methods during a labor induction. With any of these methods, you and your baby will be very closely monitored. There are some risks involved with labor induction. However, in most cases, vaginal birth is successful. Your provider will weigh out the risks and benefits with you and make a shared decision and address any questions you have about this process. Thanks for watching. I hope you've learned a little bit about the basics of labor induction.